My name is Alyssa Bowden, and I am a social work care coordinator.
My name is Jason Hughes. I'm a registered nurse care coordinator.
My name is Jacinta Phillips. I am a nurse care coordinator team lead at Partners for Kids. So Partners for Kids is like a one-stop shop.
There's so many pieces and parts that go into taking care of a child and a family that it's awfully hard for a doctor or a parent to keep track of all of these things. And that's really where the care coordinators come in.
We work hand in hand with the inpatient discharge planners to make sure that they have everything in place when they go home. So home health, medications, any therapies that they might need, all of their appointments. And they often have very expensive medications that they have a hard time getting approved through insurance. So we're really just helping coordinate all of their patient needs so that there's a little bit less stress on the family and they have one point of contact to help with all of those things.
Some of the kids we work with have multiple diagnoses and providers and appointments. A lot of times you'll have a patient who's just completely overwhelmed and doesn't know who to call. They don't know who to call to get what resource or home supply, so they just call us, and then we get a hold of who we need to get a hold of or link the family in the direction that they need to go, which improves the whole family dynamic.
We do work on a multidisciplinary team with a nurse as well as a quality outreach coordinator. Our nursing teams mainly take kids with more medical complexities, and then as a social worker, we primarily take kids with behavioral health diagnoses.
I absolutely love having a care coordinator. When I click on the chart and it says, enrolled in care navigation, I love that. I know there's another layer of support for the family.
We really are driving patient outcomes, and so you really make a difference.
For me, the best part of my job is seeing the whole continuum of care. So, I've seen kids in the pediatric intensive care unit, and I've seen them 3 months later playing in their backyard with their siblings. So really getting an understanding of their overall health and how it plays as a whole.
There isn't a normal day. We have a workflow that we follow. There are certain tasks that we have to do, but really it's patient driven. If a family calls and says they have something going on and they need your help, then that becomes your priority for the day.
We really look for people who have a strong sense of urgency and will to do the job. We also look for a sense of independence, because even though we are working as a team, everybody has a spot to hold on that team. We also look for personable people, because we deal with families. It's a live, actual, face-to-face, on the phone relationship that we build with our families.
You definitely have to have good organizational skills, as well as just be willing to be that one point of contact on that care team. I think that's a really crucial thing that we do, is that we are the center point of contact. We know as much information as we can about our families, and we're willing to share that with other providers so that everyone is able to be on the same page.
Knowing that the little things that I do is really helping improve their life, that is everything to me.